one nurse was there with me when I come down from the bed. So immediately when the blood started coming out, she now started shouting, blood, blood, blood. So before you know it, they rushed to me. So I think it was them that carried me, put me back on the bed. Then from there, I could not remember what happened.
Postpartum hemorrhage basically means excessive bleeding after birth. In Nigeria, where we have about 75,000 women that die yearly from pregnancy and delivery, a quarter of that, which means you're talking about almost 18,000, die from postpartum hemorrhage.
One pretty woman, when they brought her among these three, pretty, she delivered at home with her husband, a very young man. Seeing this lady dying, it pains me to the marrow because there's nothing I can do.
E-motive means E for early detection, M for massage, O for oxytocin, which is a drug, T for tranexamic acid, which is also a drug, IV for intravenous fluid plus oxytocin, and E for escalation. Now, this E-motive intervention actually addressed the 3-4 challenges I mentioned to you. The first was making a diagnosis. So what E does is actually now we put a drape, all right? A drape is just a polythene pouch that has calibration. So what this drape does is that every single blood that the woman loses gets into this pouch, and it is calibrated. So the healthcare worker knows exactly how much blood the woman loses, whether it's 100, whether it's 200, 500, so no more guess.
There are numbers. These numbers indicate the blood lost. So it helps us to know that, okay, this woman has lost a lot of blood. This blood is normal, but if it's getting to action, it will make us to know how to prepare. And it was so amazing that we were happy. Yes, it works.
When I deliver my baby, I see the blood is start coming out from my body. Then they quickly come and help me. They give me one injection and put one ladder. They are calling it drape, if I remember. Then after they put that drape for me, then the blood is stopped. Then they keep that drape almost 1 hour. After they remove the ladder, then I'm fine now. Me and my baby, we are well.
From what we're hearing from the field is really that emotive intervention is really saving mothers.
The emotive really saved my life. Whenever I find myself, I'm really proud of emotive. They did wonders to me.
I've had people, say that since they started emotive innovation in their site, they have not seen a single woman die from PPH.
Maternal mortality, let me just say 3 years back, in a month, we record like 8, 7, 9, like that. And let me give an example of this year. In this year, from January till November, we have had just 3. And these 3, they have delivered at home, bled, paper white. They brought the patient to the hospital. Before we could start anything, there's nothing we could do.
We have 40 facilities that we did emotive trial, and we're still taking data from these 40 facilities. And it's really showing that the rate of severe PPH has gone from 4% to less than 1%.
Da jinin ya fara zuba, nurses ɗin da suka zo suka ansa haihuwa na, shi ne suka zo suka ɗauko wannan ledan suka yi min amfani da shi. Na yi murna, na yi farin ciki kuma na gode wa Allah saboda da ni da baby duka muna cikin ƙoshin lafiya. Na gode sosai, Allah ya saka da alkhairi.
From the research to policy to implementation, we've had 100% of support from Gates Foundation. We couldn't have done that without their support. Absolutely.
I am alive and Abid is with me. So I am so happy that Emotive has saved me and Abid is with me today. I am there as his mother. I am happy.